Hi, I am Dr.Sushma Dikhit, working in Cloudnine Hospital, Patparganj as a senior consultant in gynae and obstetrics.
Antiphospholipid antibody syndrome is an autoimmune disease in which some antibodies are formed in the body which react with the lipids which are responsible for the maintenance of blood coagulation. Usually antibodies are formed to fight with the infections and diseases, but these are abnormal antibodies which start reacting to the body tissue which are normal lipids, and this reaction between the normal lipids and the APS antibodies are responsible for abnormal coagulation inside the body vessels. So because of these clottings, the mother may have clots in the lower limbs, in the brain, in the heart, and in pregnancy, this antiphospholipid antibody syndrome may be responsible for repeated abortions, for intrauterine death, for IUGR and preterm delivery. So if patient is APS positive and having abnormal pregnancy outcome, we have to treat these mothers with aspirin and heparin injections, and the outcome is very good. 80 to 90% of the patient get good results.